Hi there, Marius here with the Resuscitation Coach. On this channel, we do all things resuscitation, so please consider subscribing. In today's video, we'll start with our emergency medication series. For today's video, we'll be reviewing epinephrine. So let's jump straight in. Here we go. Epinephrine, or epi, also known in most parts of the world as adrenaline, is probably the most widely known and used emergency medication. In this video, we will review epi's mechanism of action, indications, dosages for both adult, pediatric, and neonatal resuscitation, and also review some of the side effects. Epinephrine is a non-selective adrenergic agonist or receptor activator and works on all major adrenergic receptors like alpha-1, alpha-2, and beta-1, beta-2, and beta-3. Alpha-1 works mainly on our smooth muscles contractions in blood vessels, providing vasoconstriction. Vasoconstriction increases cerebral and coronary blood flow. Epinephrine does this by increasing the mean arterial pressure and aortic diastolic pressure, which improves perfusion pressure to the brain and heart. Beta-1 impacts mainly our heart, causing increased inotropy and chronotropy, causing an increase in the heart rate. Beta-2 helps with smooth muscle relaxation in the airways. The indications of epinephrine includes cardiac arrest management, symptomatic bradycardia, severe hypotension, post-resuscitation care, and anaphylaxis. For adult cardiac arrest, we administer 1 milligram of the 0.1 milligrams per ml solution, or 1 in 10,000. We can repeat the dose every 3 to 5 minutes during resuscitation, but for educational efficiency, we can give it every 4 minutes as a mid-range. Each dose should be followed with a 20 ml normal saline flush and then elevate the arm for 10 to 20 seconds. Higher doses up to 0.2 milligrams per kilogram may be used for specific indications like beta blocker or calcium channel blocker overdose. For the endotracheal route, we will use 2 to 2.5 milligrams diluted in 10 ml of normal saline, as the uptake of epinephrine down the ET tube is not the most reliable. For profound bradycardia or hypotension, we can start an infusion at 2 to 10 mics per minute and titrate against the effect. For a continuous infusion, the initial rate is 0.1 to 0.5 mics per kg per minute. This means for an average 70 kilogram patient, we will give 7.35 mics per minute. Always titrate the dose against the effect. For pediatric cardiac arrest, the IVIO dose is 0.01 milligrams per kilogram or 0.1 moles per kilogram of the 0.1 milligrams per mole concentration. We can administer the epinephrine every 3 to 5 minutes during cardiac arrest, not to exceed the maximum single dose of 1 milligram. The endotracheal dose is 0.1 milligram per kilogram or 0.1 moles per kilogram of the 1 milligram per mole concentration, or 1 in 1,000. Administer it every 3 to 5 minutes until the arrest stops or we have an IVIO access available. For symptomatic bradycardia, the IV dose is 0.01 milligrams per kilogram or 0.1 moles per kilogram of the 0.1 milligrams per mole concentration. For continuous IV infusion, the typical dose is 0.1 to 1 mics per kg per minute. For anaphylaxis or severe status asthmaticus, we can administer an IM dose of 0.01 milligrams per kilogram or 0.1 mils per kilogram of the 1 milligrams per mol concentration. Maximum single dose is 0.3 milligrams. We can repeat this dose as needed. For neonatal resuscitation, we will use the 0.1 milligrams per mole concentration or 1 in 10,000. For the IV dose, we will use 0.1 to 0.3 mils per kilogram as per the American Academy of Pediatrics, but can use 0.2 milligrams per kilogram for educational efficiency. For the ET dose, we will use 0.5 to 1 ml per kilogram, but can use 1 moles per kilogram for educational efficiency. The side effects of epinephrine can include the following due to the increased heart rate and blood pressure: increased myocardial ischemia, risk of angina, increased myocardial oxygen consumption, increased risk of palpitations and arrhythmias, stroke, cerebral hemorrhage, to mention a few. If you benefited from this video, kindly like, subscribe, and smash that notification bell. We'll see you in our next video. Have a fantastic day.